Welcome, everyone, to the University of New Mexico Law and Mental Health Series, weekly discussions of practice and science featuring experts in behavioral health and the law. This series is run by the Division of Forensic Behavioral Sciences of the University of New Mexico's Department of Psychiatry and Behavioral Sciences in support with the New Mexico Behavioral Health Services Division. I'm Anthony Perillo, the Forensic Psychology Training Director here at the University of New Mexico. For our talk today, if you have any questions for our presenter, make sure you enter them in the Q&A box anytime you feel comfortable. Do know that we hold those questions until the end, and oftentimes it's not possible for us to get to all of them. If you are pursuing continuing medical education credits, there will be a sign-in sheet posted in the chat box shortly. If you're pursuing APA continuing education credits, that link will also be posted in the chat box, but in the latter portions of the talk, so keep your eye on the chat box for that. Once you see the link, make sure you open that link before you leave the webinar or otherwise bookmark it. And make sure you save your certificate after you complete the survey because we don't have copies of those completed surveys after the fact. If you missed our most recent talk in the series, Dr. Andrew Perkins' informative discussion of evaluating youth with problematic online sexual behavior is now available on our YouTube channel. The link for that will be posted in the chat box as well. The recording for this week's talk should also be available on our YouTube page sometime later this week, and the PowerPoint slides will be accessible for people that registered for the series later this week as well. As a heads up, next week, we have Dr. Anna Abate, who will be discussing resentencing evaluations in context of the second look movement that allows judges to review sentences after someone has served a lengthy period of time. But circling back to this week, I'm excited to introduce you to today's speaker. We'll be discussing management and care of transgendered individuals in incarceration. This is Dr. Shan Jumper. Dr. Shan Jumper received his doctorate in counseling psychology from the University of North Dakota and is licensed in Illinois as a clinical psychologist, sex offender treatment provider, and sex offender evaluator. Dr. Jumper has worked in the field of sexual violence since 1991. After conducting sexually violent predator re-examinations, court testimony, and sex offense treatment in the Wisconsin Sexually Violent Predator Program, in 1999, he joined the staff of the Sexually Violent Persons Program in the Illinois Department of Human Services Treatment and Detention Facility as a psychologist, later serving as treatment team leader and associate clinical director. An employee of Liberty Healthcare, he has been the program's executive clinical director since 2005. Dr. Jumper has also worked in private practice as an expert witness, has published various peer-reviewed articles and book chapters on sexual violence, and has served on the adjunct faculty at Argosy University, Chicago. He served on the board of the Association for the Treatment and Prevention of Sexual Abuse, the ATSA board, from 2013 to 2022 as secretary and treasurer, and then as ATSA president from 2020 to 2021. So Dr. Jumper, Shan, on behalf of the University of New Mexico, thank you again for joining our series, and we're very excited for you sharing your expertise with us today. I'll go ahead and throw it over to you.
Thank you. Thanks, Anthony. Get my screen share here. And then
yeah.
Okay, there we go.
There we go. Yeah.
All right, great. Thanks, everybody. Yes, few housekeeping items here. Oops, as soon as I can get my, there we go. So just as in a disclosure, there are no financial interests pertinent to this presentation that I have, and also the views expressed in this are from me and not necessarily the policies and positions of the University of New Mexico. In the bio already, there are continuing education credits, which Anthony talked about at the beginning. And then our learning objectives for today, we're going to talk about the institutional transgender experience in U.S. prisons, state and federal prisons. And then one of the questions I get asked the most is how do we make decisions about possibly housing inmates by gender identity? So we'll talk about some possible strategies for that. And then if we have time, hopefully we'll get to a brief discussion on bias and how that might impact the management and care of transgender inmates. Okay, so just some gender diversity terms. You can take a look at these. Cisgender is the adjective that describes people whose gender identity is congruent with their biological sex. Gender curious, gender identity, gender nonconforming, intersex. ISO is a term used in here, an abbreviation for individuals who sexually offend. A few other relevant terms. I use the term TGD, which is transgender/gender diverse. And that's from the new version of the WPATH standards, the recommendation for the term that they use. So I use that term frequently throughout the presentation. Also, transgender woman or transgender female, which is a biological male who identifies as female, and then transgender man or transgender male would be people who identify as male but were born biologically female. So these are just a few basic terms. One, just quick note, terminology in this area does change quickly in terms of what's acceptable and preferable. There are also a lot of regional differences. So you want to do your best you can to stay current, and easiest benchmark for that is to ask your clients what terms they prefer. Some issues trending in the field over the last 5 years. The 2022, the new WPATH standards came out, version 8, which represents a move away from a disease-based model to one of informed consent. There has been a lot more research in recent issues on transgender issues and mental health care. I think I first presented on this topic in 2019. I just wrote a book chapter last year, and I think almost every citation that I had on transgender issues was within the last 3 to 4 years. So there is a lot more coming up in the literature to kind of help guide us. Still not enough, but more so than in recent years. We're seeing a shift in institutional policies in prisons and other residential settings where patients or inmates are given the opportunity to identify as transgender or gender diverse, and how that works. Lots of media attention on transgender issues in recent years. I think Vice President Biden about 10 years ago had referred to transgender issues as America's next civil rights issues. We hear different versions of that in the media with respect to sports participations and public restrooms, transgender care for youth, also kind of a controversial suspect or topic. More acceptance in the public, I think, of gender as something other than a binary construct. So we don't all fit into 2 categories, which is encouraging. And how do we learn about new populations? This is still relatively new populations with not a lot of empirical guidance for carceral settings and prisons, but basically it's talking to each other, asking questions, networking, sharing ideas, and looking for clues and things like that. So some figures on the frequency of transgender and gender diverse. Probably the most poignant thing to point out here is how much the statistics increase if you go to the term gender diverse as opposed to just transgender. So it can be for adults as high with gender diverse as the marker for definition, just under 5% of the population. So quite a bit more than anyone who's strictly transgender. So we're seeing a lot of variance in gender identity and how people are expressing and living with that in their lives today. And there has been a significant increase in the last 8 or 10 years or so in terms of who identifies as transgender or gender diverse. Most notably, adults 18 to 24. That's the number of adults identifying as transgender in that age group has increased by 5 times, quadrupled among 25 to 34-year-olds, and either declined or did not change significantly among those older than 35. Again, so there's 2.78% of 18 to 24-year-olds identifying as transgender. And the increase was actually driven by those identifying as transgender men or gender nonconforming. So more biological females identifying as male, and then people identifying as gender nonconforming. And the increase in self-identifying was more prevalent among white people than in Black or Hispanic individuals. And the increase was similar in the states politically. So red and blue states saw a nationwide shift or about the same route of exchange or increase. Some things to notice about transgender and gender diverse individuals in incarceration. 16% of transgender individuals will be incarcerated at least once in their lifetimes. This is compared to figures of 2.8 to 6.6% of the general population. So quite a bit more with this marginalized group. 47% of Black transgender persons will be incarcerated. And it's likely that these figures are underestimates, as you'll see today as we go throughout the presentation. Many justice systems do not record or report data on gender identity. And also many transgender persons are fearful to disclose when incarcerated for reasons that certainly are understandable. The other aspect to consider about this population in prison settings is the much more higher rate of sexual assault by transgender inmates. 1/3 had reported in the last 12 months had been sexually assaulted either by staff or by other inmates. And transgender inmates are 10 times more likely to be sexually assaulted than cisgender inmates. So just what is the prevalence? How many transgender individuals do we have in our prison system these days? There was a news report from 2019 on NBC News where the reporter tried to determine by contacting each state how many transgender inmates they had in their system and how many were housed in women's, so how many transgender women were housed in women's facilities. And at that point, they had identified a little under 5,000 transgender inmates in 45 states in the District of Columbia, with 15 of those transgender women housed in women's facilities. I started progress earlier this year. I'll describe a little bit more about how I collected my data, but I'm working on getting some updated figures for that. So that is now 5 years later, and by this series of strategies, which I'll talk about in a minute, I was able to identify just over 10,000 inmates identifying as gender diverse in state prisons. Again, the majority of those are male to female or transgender females. Very smaller portion of transgender men, and then some states actually did categorize by either gender nonconforming, non-binary, or intersex. So I was able to identify a few people from that population as well. States who responded, who had the highest population of transgender inmates, were Texas, California, Kentucky, Florida, and Pennsylvania. And most recent estimates about transgender inmates in the federal prison system indicate that there's just under 1,300 transgender women and about a little less than 700 transgender men. So about 2/3 of the inmates in the federal prison system are transgender women. Some prevalence internationally. Corrections Canada put out a report last year describing their transgender population. They had 99 transgender inmates. In the United Kingdom, that figure is actually a little bit probably dated. I think the 2024 figure is 244 transgender women. New Zealand is some older data that I found from 2020, and Ireland with just 2 transgender inmates. So basically, I sent it near the end of last year. I sent out a series of FOIA requests to all of the State Department of Corrections, asking for a redacted list of inmates who identify as transgender or gender diverse, and what was their sex assigned at birth, what was their current gender identity, what race, and then what holding offense information, what offense were they serving time in prison for. About half of the states replied that they didn't have any documents responsive, again, just pointing to the fact that a lot of jurisdictions aren't recording or reporting this data. A few others charged some pretty exorbitant hourly fees to retrieve and create the data. And a few never responded at all. In 5 states, I've discovered that their Freedom of Information Act laws are only for in-state residents. And many states did reply with partial data if they didn't have all of it. So there were 12 states in the federal prison system that pretty much responded with all of this data that I asked for. The other other strategies I used to generate estimates of how many transgender or gender diverse inmates were in prison system was by examining PREA audit reports that were available online for the other districts who didn't report the information to me directly. These were likely underestimates depending on the version of the PREA report that you were using, but so the 10,049 inmates, transgender inmates in state prisons is most likely, again, an underestimate for the reasons that we've discussed. So comparison, let's see, what do we do here? Okay. I think that is in the wrong slide, wrong order, sorry. So these 12 states who responded with all of the information I asked for, including race. So these were the number of transgender inmates with sexual offenses by race, and in these 12 states. So you see 17% of the Black transgender inmates were serving time for a sexual offense, 38.2% of the white residents, 33, so just over a third of the Hispanic gender diverse inmates were serving time for sexual offense, and then just a handful of Native Americans and other races. By contrast, then, let me go back 1 second. Okay. By transgender men or biological females, so identifying as male, we see much smaller numbers, and that's pretty consistent across all jurisdictions. And also a much smaller percentage of the transgender men with sexual offense convictions. So only about 6% as opposed to about 30% of the transgender female. So big difference there. Okay, and then there were, like I said, 2 states who did kept really good records and had not only transgender inmates, but intersex or gender diverse or non-conforming. So in that group, there were 21 transgender inmates with sexual offenses. 19 of those were non-binary individuals who were born male at birth. Now, how did that get back there? And in the federal prison system, then, transgender women, just under 1,300, about 47% of them, so a higher percentage of federal inmates, transgender inmates, are serving times for sexual offenses. And I think it's because most of these would be child pornography offenders, tend to end up more in the federal prison system than in state systems. And for transgender women in the federal prison, again, much smaller number with only 7% in serving time for a sexual offense. Internationally, populations, transgender populations with sexual offense convictions. Canada, about 1/3 of their 100 or so transgender inmates were serving time for a sexual offense. In the UK, it was about 60%. So here now to look at just what kind of categories of crime beyond sexual offenses for transgender women with all criminal convictions. So this, I had data from 8 states plus the federal system by race. And we're showing these are all races together, sorry, not separate. And again, the most common offense as a group that gender diverse people are incarcerated for in prisons are sexual offenses, followed by battery or assault, and then robbery and theft, or drug and alcohol or weapons offenses, followed by murder or manslaughter. And just to compare, let me go up. Here, so all inmates in state prisons in 2020, rape or sexual assault was the most common violent offense, followed by murder, then aggravated assault. So in state systems, about 15% of the inmates, all inmates, cisgender and transgender, were incarcerated for a sexual offense. In federal prison, it's higher, about 21% of all their inmates serving time for a sexual offense. Okay. So for transgender men, you can see the data with and without the feds there. Again, sexual offense is much smaller, 4% or 6%, depending on if you're including the feds. Big difference in violent non-sexual, much more higher percentage of those in the state prisons. And then you see the same thing with drug and alcohol. Drug offenses, another common incarcerated offense in the federal prison system. And you see the percentage with the federal prisons there about twice as high as just the states alone. So one thing I think that's really interesting and is going to be sort of a key to helping us understand these populations a little bit more, the impact of childhood trauma for transgender and gender diverse individuals. So that had research is pretty consistent. So the adverse childhood experiences scale, which I'm sure most of you are familiar with from Kaiser Permanente back in the 1990s. That's the list of 10 childhood adversities. And in that original study back in the 90s, the mean score from a very large insurance group sample was 1, and with only 12% of the sample reporting 4 or more adverse childhood experiences. In transgender populations, in the studies on adverse childhood experiences, most of them are, the samples are reporting 4 or more adverse childhood experiences. And then psychological and emotional abuse is the most commonly reported. So verbal abuse, psychological abuse, most commonly reported by transgender person across all samples. So it's almost universally that was the highest or the most often seen adverse childhood experience. Physical and sexual abuse were also common in many of the samples, but not in all studies. A couple of other interesting findings in this area is that resilience seems to mediate the impact of ACEs on mental health, but those individuals who report physical and emotional neglect, emotional abuse, and mental illness in the home were less likely to be resilient. And then transgender individuals with 4 or more ACEs were 26 times more likely to report high-risk HIV behavior. Some similarities really existing between the impact of childhood trauma between gender diverse populations and individuals who sexually offend. Initially got interested in this, doing some writing and discovering in some of the popular media, the high percentage of inmates in different jurisdictions who were reportedly incarcerated for a sexual offense. And that's what led to my starting this other project to try to expand that. And we don't really, again, we don't know why that is, or, and again, those numbers are likely underestimates, but we do see a pretty high frequency of gender diverse individuals in prison for sexual crimes. So similarly to transgender populations, many studies have found that with people who sexually offend, they're also reporting 4 or more adverse childhood experiences, and emotional abuse or verbal abuse, psychological violence. That item, again, much just like with transgender, is the most commonly reported adverse childhood experiences of people who sexually offend. So I suspect, all of our data right now is preliminary and anecdotal, but I think we're going to find that studying more about childhood trauma will help us understand more about why such a high portion of this population may be incarcerated for sexual violence. Go back. Oop. We going. Okay. All right, so like I said, we have much better data on transgender women. There are many more transgender women, biological males identifying as female, who reside in the prison system. And among these individuals, it's very difficult to tell with the sparse data that we have, but the offending pattern, as you saw earlier, more closely resembles their sex at birth versus that of their gender identity. What makes it really impossible to tell is that the individuality of gender identity and the fluidity of gender identity makes it any kind of conclusions really difficult to generalize. Many or most of these individuals may have been living as their biological sex versus their identified gender while they committed their crimes. So it makes it really difficult to generalize or make any comments about transgender offending and patterns. Again, very little data on transgender men, although it looks like their crime patterns may be more closely tied to gender identity. And transgender men are more likely to be incarcerated for drug or property offenses. But again, really, all we can see is some initial trends, really too soon to make any conclusive statements. There was one study that that followed a group of transgender individuals in Sweden after they have had sex reassignment surgery, and then compared them to a control group of their birth sex. They broke these up into 2 cohorts, those who they followed between 1973 and 1988, and then 1989 to 2003 was the second cohort. They studied them differently because they also received mental health treatment. The findings were pretty much the same regardless of cohort, where it showed that transgender women or biological males identifying as females retained a male pattern regarding criminality, and the same was true for violent crime. So transgender women were over 6 times more likely to be convicted of an offense than female controls, biological female controls, and 18 times more likely to be convicted of a violent offense than their female control group. So that's really the only study that we have that has, that is not in the right place. Sorry about that, 1 second. Here it is. Sorry, having some problems here. 1 second. Let me just stop this for a second, start it back up again. No, sorry, 1 second. Okay, here we are, sorry. So the big controversy or the big conundrum in a lot of prison system is how to decide where to house transgender and gender diverse inmates. So the first thing I think is interesting to look at what do these people say? What do transgender women say about where they would like to reside? And there was this systematic review in 2022 of 14 studies that looked at this transgender women prisoners and their experiences in male prisons. And these subjects experienced a sense of community and support from their fellow transgender inmates, but don't seem to feel particularly close connections with them. And they reported they were not particularly in favor of special units for transgender individuals. One inmate said, "It's odd, you want friends, other transgender women, but you don't want the hassle, the drama that comes with them. I'm torn. I want them around, but I don't want them around. It's good and bad." And the other finding from this review is that acting in typically feminine ways led to idealized responses from male prisoners towards them as women, which they valued. So I then did a second Freedom of Information Act request asking for the number, same thing again to the Departments of Corrections, asking for the number of transgender women, men, intersex, gender nonconforming, et cetera, inmates who have requested placement in institutions consistent with their gender identity and the status of those requests, and how many inmates currently are housed in facilities consistent with their gender identity. Even fewer responses on this. Almost all states responded with no documents responsive, meaning they don't track this or report this information routinely. One state did reply saying that none of their 109 transgender inmates had requested to be housed according to their gender identity. And then 3 other states did respond to the full Freedom of Information Act request. So one state reported that 75 of the 336, or 222% of their transgender and gender diverse inmates requested housing consistent with their gender identity. 10 of those 75 requests were approved, all for transgender women. There were 4 transgender men who requested to be housed by their gender identity, and they were not approved. One other state, 32 of their 450, or only 7% of their gender diverse inmates requested to be housed according to gender identity. 3 were approved, 3 are still under review, and the other 26 were not approved. They didn't give us a gender breakdown, but mostly, again, most likely those are transgender women that were approved. The third state, 35 of 155 gender diverse inmates, or 23%, requested. 7 of those were approved, 28 denied. One other state responded that 11 of 44, or 25% of their transgender inmates requested gender congruent housing, and all were denied. And the report from California in the media in 2023, again saying 18% of the transgender women had requested housing by gender identity, with 47 of those, 298 approved. And there were 11 transgender males who applied for gender congruent housing, but none of those were approved. So that may be slightly different in the year since that information was available. Okay, so we know, again, in 2019, in the NBC News story, identified 15 transgender women housed in women's facilities out of just under 5,000. I've been able so far to locate 99 that are housed by gender identity in the United States. Again, most of those are transgender women held in women's state prison. Did one state that houses a transgender male in a male prison. And then the other 10 were transgender women from the federal prisons that are housed in women's federal prisons. Internationally, Canada, 10 of their 99 transgender inmates are housed in women's prison out of 16 who requested it. And New Zealand, again, that data is a couple years old, was housing 5 of 35. Again, so takeaways is most transgender inmates don't request to be housed according to their gender identity. And it looks like some of them, a good number of them are not necessarily being approved, but a small number initially making the initial request. So what about special housing units for transgender inmates? PREA says no, that you can't do that unless staff makes an assessment that there's no alternative to keep them safe. And that's, again, only until an alternative means can be arranged. Or the other provision in PREA is if there is a consent decree from a federal court, then it's okay to do this. And that is currently happening in Illinois and Colorado. Both states have had some federal litigation where the result was a consent decree to start special transitional or transgender housing units, one each in a male facility and one in a female facility. Some county jails experimented with special units in Chicago, San Francisco, New York. They're finding that special units, they don't typically have access to the same programming and resources, which is another concern expressed in PREA. And WPATH is recommending that institutional personnel establish housing policies that ensure the safety of transgender residents without segregating or isolating them. So that's what WPATH has to say about it. New York corrections in Rikers Island had a special unit in 2015 and 95% of those participants reported feeling safer in that separate housing area. It became an LGBTQ plus unit in 2019 and then collapsed in 2023 with a change in administration. This is the American University of Washington College of Law. There's a link there. They have policies about housing, carceral housing for all the different states. That leads you to some information on those. Okay, so some different options for assessing for housing by gender identity. So what are some things that we can do in prisons to help us make the determination? Well, the first, I don't have it on here, but would be to check the PREA policy. There are obviously some guidelines for institutions to use related to making housing decisions put out in the PREA legislation. Some other strategies for doing this would be current gender expression. So looking for clear evidence of living consistently and permanently in the preferred gender prior to incarceration. Of course, there might have been many valid reasons for them not openly living in the preferred gender, but careful interviewing around this topic can help avoid potentially faking by inmates looking for an easier time in prison, or those who are looking to access potential sexual partners or victims. And that's something we've seen really kind of blown up by the media. There have been some cases where this has happened. England has, or the United Kingdom has struggled with this. They were really the first to house transgender women in female facilities back in 2016 after a series of debacles where the transgender women housed in female facilities sexually assaulted the other female prisoners. The UK now very rarely will house a transgender inmate in a female institution, especially if they've been convicted of a sexual offense or if they still have an intact penis. So it has definitely changed a lot. There have been a couple of cases here in the United States, but all in all, pretty low base rate event for this. But it is still something that we want to make sure that we're screening for. So some other things to think about would be, what would be the likelihood for this individual to perpetrate sexual abuse or other violence? So some different areas that psychology or mental health staff can assess. So for transgender inmates with sex offense histories, you can do use the actuarial risk assessment instruments, looks at static and historical factors, and also dynamic risk. There's a stable 2007, which measures dynamic areas of risk for sexual offending, such as deviant sexual interests, hostility towards women, impulsivity, lack of concern for others, loneliness, negative emotionality, etc. Again, for transgender inmates with a sex offense history, you can gather that information from file review and interview. Some other strategies, especially for inmates with sexual offense convictions, you can conduct a detailed review of this sexual history and verify it by some different measures, such as the PPG, or the penile plethysmograph, which is a physiological measure of biological male sexual arousal. Viewing time measures are similar, only it's a less intrusive, more like a reaction time type test. And the polygraph also to verify an individual's sexual offense history, if there's suspected sexual offenses that weren't charged or convicted. And again, age and physical health. In certain cases, advanced age or an inmate's medical condition can also be a protective factor suggestive of lower risk. And all these you can do, the PPG, the viewing time measures, and the polygraph, and the age factor. They can be done with offenders who are not necessarily serving time for a sexual offense, but to just gather more information about areas of concern when you're making these decisions. So those could all be put in place for just about any inmate asking this. Again, this is mostly would be for transgender women, obviously. And then the last thing to look at for any of those gender diverse inmates who've had a sex offending history, positive treatment reports could also be a protective factor suggestive of lower risk. So for those of the history of sexual offending, static 99 is one of the main actuarial instruments used for estimating sexual violence for reoffense estimates. The static 99 is only recommended at this time for use with adult males. Male to female transgender clients are considered male until near the end of the process, specifically to be considered no longer a male for static 99 purposes. The individual must not have a penis and have lived for at least 2 years as a woman. Static 99 doesn't apply to female to male transgender offenders, as they're outside of the sampling frame of the scale. And as there is no research currently available on risk factors for transgender women, there was no research available to inform these rules. So that's just something to keep in mind if you're using any actuarial assessments. So what is happening in the prison system with management of gender diverse individuals? So as part of this project that I've been working on too, I was able to locate policies on gender dysphoria or gender diversity in 41 of the 50 states. Those were all available online. 8 states, I was only able to find a PREA policy and nothing special for gender diversity or gender dysphoria. And also 36 of the 41 states indicate that gender-affirming hormone therapy is available. All of them describe procedures for continuing this if they had been prescribed it prior to intake. And pretty much all of them also have procedures in place for initiating hormone therapy after admission to the prison. Gender affirming surgery starting to occur following some federal court rulings since 2019. 21 of the 41 state policies indicate some type of procedure for gender affirming surgical treatments, and 37 of the 41 states provide counseling for gender dysphoria or gender identity concerns. Something new too is 19 of the states now have policies where gender diverse inmates can request the gender of their officer doing the PAT search. And the prisons will accommodate based on availability. A few other trends about how transgender and gender diverse people are being managed in the facilities these days. Many states are making cross-gender hygiene and makeup products available for purchase on the commissary. Many are providing access to feminine undergarments. Sometimes a diagnosis of gender dysphoria is required for either of those, sometimes not, depending on the state. Most states have some type of a special committee or a multidisciplinary team to evaluate and manage their transgender inmates, all the requests for housing and accommodations. Many jurisdictions are encouraging or requiring staff to use inmate preferred pronouns. And then again, there's some of the states, 8 of the states where I was not able to find a specific policy for gender diversity beyond what the standard PREA and sexual assault policies gave. So just compared, how does that compare to 10 years ago or 9 years ago? Well, in 2015, there were none of the states had a policy where transgender individuals were able to state a preference for the gender of the person conducting their search. 2015, there were 39 states that were starting to develop policies for transgender care. I was able to locate 41 official policies. Now it's possible that there are more that I was just not able to, or that I haven't been able to locate yet. So that's important to note. Again, 2015 for hormone therapy, 13 allowed for initiating it after admission, and 21 for continuing. Or now it's really 36 of 41 are allowing for initial and continued gender affirming hormone treatment. 2015, 31 states allowed for mental health counseling for gender dysphoria. That's now up to 37. And surgery in 2015, 7 states addressed it, though none at that time had performed any gender affirmation surgery. In 2024, we see that's about 3 times as much, with 21 having, or the policies in 21 states speaking to how surgery would be handled. And we have had a handful of completed surgeries. Often those have been ones that have been ordered by the court system, but they are starting to take place now. So we are, I'm going to stop here just in the interest of time. I would encourage all of you to read the slides on understanding trans and managing bias. That will be, we don't have time to go through them all, but they'll be a very important supplement to the work that you're doing with this population. So we can probably go ahead and open the field up for some questions, Anthony, or?
Of course, yes. Thank you so much, Sean, for that thorough overview. And like you referenced here, for those that are here at the webinar, they will have access to the completed slides and can review those slides on bias. We do have plenty of questions in the meantime, and the APA link and other CEU links are in the chat box. Go ahead and check those, make sure they work for you. If not, you can bookmark them for later use. Someone did want to clarify as an update that the static team had recently come up with a revised statement that says if born biologically male, the static 99R now can be used in perpetuity at any point. They put a link as well for the static FAQs. That's been a recent update to that.
Okay, great.
Yes. Regarding, some people had questions regarding scope, just for clarification. Someone said, when we discuss trans women, does this group when we're talking about research, does it include individuals who have not had gender reaffirming procedures?
Yes, it would. In most cases, it's based on their self-reported gender identity. So they may or may not have had either hormones or surgical treatment.
Great, thank you for that clarification there. Somebody presumably from their own state asking if Virginia was one of the states that you had received data from?
No, Virginia is one of the states that the Freedom of Information Act is only available to residents of that state. So then I did get some numbers from Virginia by looking at PREA audit reports.
Sure.
So they're underestimates, but I was able to get some figures.
Fair enough. And someone said, of course, thank you for collecting all these data. They wondered if there was any information available regarding DHS or ICE detention facilities.
Not that I have found, but I haven't really looked either, so I couldn't say.
Sure. Any data on when the offense occurred in relation to any transgender status, say like before any transition or after?
No, there really is nothing. I mean, that's why it's hard to really make any conclusive statements. I mean, that's something, for, research going forward that would be really good to know and informative, but there's just simply no way to tell. It's by when the person gets to prison, are they identifying that, but there's no data on when that occurred or when they transitioned or not.
Sure, thank you for that. Somebody asked if there's any research data on hormone treatment and how that would potentially impact somebody's risk.
There's not any research that I'm aware of that directly speaks to a change in risk with this population. There is quite a bit of research that suggests that a lot of other related risk factors, may improve with hormone treatment. So the quality of life and just emotional regulation and general mental health markers are likely to be improved. So one way that you could speak to that was to look at the research on the benefits of hormone therapy that kind of overlap with some of the dynamic risk factors for reoffending and speak to it indirectly that way.
Sure, thank you for that. From maybe more of a interprofessional management perspective, somebody asked, any recommendations for working with correctional officers who believe transgender people are faking or mock or verbally abuse them, like calling them by the wrong gender or laughing at them for wearing a bra? This is with no help from administration.
Yeah. Well, the best thing I could say to that would be in training. If you have the opportunity to train like we do at our facility, it's not technically a prison, but it's very similar in how it's set up. So the clinical staff has a week of training for all the custody staff coming in. We do a lot of things on transgender and trauma-informed care. We do that annually with the regular staff who've been here for a while. So it's hard. You certainly need to educate your administrators so that they can support and enforce. In looking at all of the state policies, many of the states are quite explicit about things like that and will come out and say, make a point to say that it's our policy to treat these inmates with dignity and respect and to avoid, microaggressions and things like that. So that's probably what I've noticed from looking at the policies is just a real heavy emphasis on training and then educating your upper level administrators.
Absolutely, thank you for that. Somebody asked, I guess, more broadly in terms of this research, in terms of what constitutes a sex offense. There's quite a range of things across different jurisdictions that can count, of course. And they wanted to know if there were particular types of sex offenses that were more common against the transgender population.
You mean more?
I'm sorry, more common within perpetration.
Perpetration by them.
Yes.
I haven't noticed any real patterns. I know there's some differences in states. I think in terms of looking at some of the different incarceration rates for transgender individuals in different states, that some states seem to have a different, like in one state, there were several transgender people who were in, their crime was purse snatching, which is not, I mean, that could be a robbery, it could be called something else in another state. Some states, I think it's possible, may still have some outdated, like sodomy laws and things like that, where they may be more likely to attack those or attach those to marginalized populations. But in general, I don't know. And again, this is just looking at the states that actually listed the name of the offense. They seem to be kind of all over the gamut against, you know, children and adults. Probably more, I would say, crimes towards children, but that's just anecdotal. I haven't counted it.
Okay. Any information about how states decide gender affirming surgeries? I assume this question's in the context of incarcerated individuals. But...
well, I know, like I said, sometimes it's, and a lot of the recent ones have been court ordered, but also I know in Illinois, we have a couple of inmates in our correctional system that are getting ready for transgender surgery. And I think that probably the most common feature I could say is that you really need to hire a good consultant in terms of somebody who has very specific expertise in transgender care. We did that here at our civil commitment program. We have 2 transgender residents who were recommended for surgery, but they were also very close to release out into the community, to the community release portion. And the expert recommended that they have a successful period of adjustment in the community living as a woman, and then reevaluate their desire for surgery. So it's starting to happen, but most largely from really now several states will do state specifically in their policy that genital self-mutilation does not automatically qualify one for gender surgery. And I think that must be obviously in response to, I know some of the initial cases where the federal courts did order states to provide surgery was after an incident like that had happened. So I don't know if that's what prompted that language, but it's definitely a medical need is the situation, and you really need to have somebody with the specific expertise who can make that decision either way. And I have people want to email me. I have a list. I have a couple of people I could recommend that people could contact.
Wonderful. Thank you for that outreach there. Somebody putting a plug in for those interested. The podcast Ear Hustle, extensively covering issue of housing transgendered women in women's prisons in California. And as we wrap up here, one final question. Somebody asked if you have any data or perspective on the prevalence of autism spectrum disorder among transgendered inmates.
Yes, I don't have that right in front of me, but there is some research that suggests it's it may be a slightly higher base rate for gender diversity among autism spectrum inmates.
Well,
I can find that if somebody wants to email me, I can find that study and send it to you. Wonderful.
Well, Dr. Jumper, Shan, we are at the top of the hour. Thank you so much for the work that you do in this area. What an under-researched area, an under misunderstood area, both in terms of just as management and care needs and an overall humane approach to incarcerated individuals, and looking at unique circumstances of different individuals and getting them the basic care and also human dignity within incarceration perspective. So thank you so much for all the work that you do here and for sharing all of this with us.
Thank you. My pleasure.
That wraps up this week's Law and Mental Health series. Next week, we have Dr. Anna Abate, who will be covering resentencing evaluations in the context of the Second Look movement. We hope to see you then for another great discussion of behavioral health and the law. Until next time.